Hi, I'm Dr. Mark. I've been in practice since 1980, and I had the good fortune of doing my undergrad and graduate studies in the 70s. And I saw the huge cash practices of those days. Then into the 80s and 90s, it was all about the personal injury, the workers' comp, and the health insurances. Well, as around 2000, things started to go full cycle. And now it's all about the cash again. Everybody's talking about cash programs. I couldn't agree more. For the last decade or so, I've curtailed my practice to involve predominantly the personal injury and cash practice. Here's the thing about my cash practice though. I get paid $98 to $121 per visit prepaid. And I have put together a program of care that the patients want to be part of. And I have that completely laid out, so it's just like a hot knife through butter. But that's why I'm doing my video. See, I've consulted with doctors around the country and around Europe. I happen to be the co-founder and vice president of the Ukraine Chiropractic Association, so I have the good fortune of consulting with doctors in Europe as well, who, by the way, most of them don't use x-ray, so they really have to convey the concept to their patients a little differently. But the thing about the cash practice, here's what's exciting about the cash practice. It allows you, the chiropractic specialist, to completely embrace the truth about what it is we do. See, for the patient to want to pay me $98 to $121 and more, but I generally keep my price in that range, they have to get what it is I offer. And they have to get me as a specialist. See, we already know that the patient's, in all probability, been to the general practice MD, they've been to the neuro, they've been to the ortho, they may have gotten surgery, they may have been to 2, 3, 5 other chiropractors. And then somebody said, hey, why don't you go see Dr. Jones? He or she can help you. And so then they come into your office. Well, here's the thing about the cash practice. It allows you to embrace the truth about what we do. Brain, central nervous system, and its influence on every cell in the body. And the client, about halfway through, or certainly by the end of your intake consult, they should start to suspect that, wow, I finally found the real specialist I've been looking for. Well, by the time the exam's done, they should start to get the idea, I found the right specialist because she or he is now finding things in the exam that none of the other doctors found. And once that occurs, then you start to elevate who you are in their mind. By the time you're done with your x-ray, which is pretty much the end of that first visit, they should pretty much want to follow your advice, which should be this. You know, Miss Client or Mr. Client, I want you to be sure and bring your significant other to the next visit because I'll be going over your findings and talking to you about what it means to be a client in our practice. And they're going to want to bring their significant other because of the experience they just had. See, it's all about being a specialist. Now, a lot of doctors I talk to, see, they're getting $30, $40, maybe $50 a visit. Rarely do I find one that's getting over $60. Well, the reason that is because they're not the specialist they could be. See, they're just not the specialist they could be. See, if you had cancer, you wouldn't be out price shopping. You'd be looking for the top gun, right? You'd be looking for the specialist. Well, if you have that presentation in your practice, then your clients that walk into your office, they're not going to be looking for the cheapest either. I get referrals from other doctors, other chiropractors, who are charging $30, $40, you know, maybe $50. And the referrals that come from their office pay me $98 to $121 per visit prepaid. And I do $3,000 to $5,000 programs of care, short programs of care, because then I qualify for my clients for what I call staying well care. See, they got well, they might as well stay well. And we have about an 80% batting average on our clients that want to continue to be part of our office. That includes our personal injury clients who, once they've completed their trauma care, then want to participate in our staying well care. There's several things that make a difference. There's several things that make a difference. And I learned this back in the 70s. See, a lot of the big practitioners back then, they were talking about things like the books, Think and Grow Rich, Magic of Thinking Big, The Millionaire Mind later on, The Master Key System. Books that if you haven't read, listen, if you don't do anything else from watching this video, get them, especially The Master Key System. Immediately change your brain, change your reality, change what you do. So it's, but here's the underlying theme in almost all of them. And there's several underlying things, but here's the big ones. How are you using your time? See, if we are spending our time trying to figure out what's already been figured out, that's a huge waste of time. Think about it. Your time is the one irreplaceable commodity that you have. Everything else is replaceable. Cars, houses, clothing, relationships, whatever. It's all replaceable except your time. So how you use your time has everything to do with the millionaire mentality, the success mentality. See, if you're spending your time trying to figure it out, that's just stupid. Here's how you should be spending your time. You should be spending your time perfecting, personalizing, and polishing what's already known so that you take a higher level of ownership. All your time spent towards just being the best you can be rather than figuring it out. Here's another big issue across the board. It's about values. See, the personal injury arena has certain values that you have to apply to that arena. The workers' comp arena, same thing, and they're not interchangeable. Slightly, but basically no. The cash arena is a value-based system. You've got to convey the values of what you do directly to the individual. Once the individual gets it and they marry that with their miserable state and the fact that they've been every place and no other specialist can help them, once they get that, now you can get your fee because they're going to see you as the expert and the specialist that you are. Now, like I say, or I may have said, I don't do spinal decompression, I don't do lasers, I don't do any attended physical therapies, EMS, ultrasound, ice, heat, massage. I don't do any of that. I adjust. And I do put patients on some tables that I bought back in the middle 80s or so, the traction tables. They're unattended. I show patients how to get on them. I'm busy adjusting. The adjustment is what makes me the specialist. But my patients or the potential clients that walk into our office get it, that I know what I'm doing and I'm a specialist. And so that's why they're willing to pay me what they want to pay me. Here's the other thing about the cash practice, it's so exciting, is it allows you to just embrace everything that chiropractic has to offer. And the cash is where you have to relate the values directly to the individual, not to the insurance company, not to the attorneys, all that stuff. It's a one-on-one relationship, and it opens doors that are not available in the PI work comp and insurance programs. The cash practice is where the doctor, the specialist, finds her or his own heart. And that heart, once it's conveyed, and I have all the systems in place, it couldn't be simpler. See, the systems are set up for the client. Most of them are coming in just like your clients. They've got all sorts of illusions about what's going on. They don't even know where the specialist is. But once they're through with your first visit, second visit, they now know they found the specialist they were looking for, and that's how you get $60, $70, $80, $90, $121 per visit prepaid, and then have a huge success rate with staying well. I hope you do something with this short video. I'm going to look forward to working with the ones that do. Thank you.